videos, then that's what it's gonna have to be. Hi, welcome back to my channel. My name is Esther. I'm a nurse clinician here in Montreal, Canada, and I make videos about being a nurse in Montreal. So if this is of interest to you, please hit the subscribe button so you can see all of my videos. All right, so this video will be about how to become a clinical instructor, what it takes, the qualifications and everything. So this field is actually in high demand because nurses, I think, should really tap into it, only because we are always in need of nurses. The profession is growing, people are leaving, people are coming in, and it's a great way to keep up with your clinical skills, your critical thinking, especially if you're not working at the hospital or in community. So let's define clinical instructor. So it's basically teaching and supporting nursing students and their clinical stage or clinical studying. So it just depends on the role, and it typically is held in hospital, a clinic, community, a rural area, and you basically help students reach their learning objectives of their class. So learning objectives from their school, whether it's college level or university level. It's an important role because there will always be new nurses coming into the field, and they need mentors and they need instructors to guide them to becoming competent and motivated nurses who will make a difference in the lives of people. So whether it be at the happiest moments of someone's lives or in an acute emergency or at the end of their lives, there's just so many different fields of nursing that people can go into. So if we're able to support the newcomers, why not? Let's discuss the challenges. So the challenges of being a clinical instructor. So, challenges can arise when students are not meeting course objectives, or there's like a couple red flags that need to be addressed. And the solution is basically informing their course professors and to helping them create a plan, like a SMART goals plan that aid in helping them be successful in their clinical setting. And of course, nurses who do not like to have students, there's always that one or two or three. But you have to do what you can. You just don't pay that any mind, or you address it. If you have to address it, you address it. And if you could just avoid giving those students that particular nurse, then that's what it's gonna have to be. Okay, so a few things that you as a clinical instructor must assess. There might be more according to the school, but quickly, this is like knowledge, clinical reasoning, physical assessments, nursing skills, communication, and interactions with family and team members and other stakeholders that they work with. All right, so let's dive into the qualifications, skills, and experiences required to become an effective clinical instructor, which includes the following. So let's review the qualifications and required experience. So again, it depends on the job posting or whatever the school requires. So it depends on which clinical rotation you are interested in applying for. So typically, you should read the description on required experience. You often need a bachelor's of nursing degree. You need an up-to-date vaccination record, a valid CPR, active nursing license. They prefer previous teaching experience. It's an asset, but for me, I didn't have this. But I did have experience in orienting, oh my God, new nurses. So usually for experience you need would be like a med-surg background, emerge, ICU. But again, it just all depends on the job posting. So some expectations. So typically you are expected to help the student master many nursing tasks and skills such as IV insertion, blood draws, Foley catheter insertions, wound care, and to also help them think critically by showing them how to connect the dots, which I love. And benefits of doing this is basically to help, again, the new generation of nurses keep up with new clinical practices, new clinical skills, critical thinking. How did I get this position? So I applied randomly sometime in July 2024, And I was called 2 weeks later, and the interview process was quite simple. Like, they questioned me on my nursing background, my education. They asked me specific questions about how I would react to a staff member saying bad things about my student. And basically I would just address this directly with the student to see their side of the story before jumping into any conclusions. And I guess she loved that answer, so I got the job. Like, I think a day later I got called back and I received like a job offer, so that was pretty cool. So in conclusion, you know, being a clinical instructor takes a lot of courage, a lot of patience, because you are teaching students that have no idea what it's like to be a nurse. So you really have to think about if this is something that you would like to do. But I do hope that you enjoyed this discussion on how on what it takes to become a clinical instructor, and I hope it really helped you to decide whether or not this is something that you would like to do or not. So thank you for making it to the end of the video. Please check out my other videos. I have a playlist on nursing, my nursing journey, and there you will find all of my nursing content. So if you like this video, please hit the like button, subscribe, comment, share, and do all the things. And you will see me on the next one. Deuces.